Glucosamine sulfate. What is glucosamine sulfate? Subscribe and comment. Integrative medicine. Soledad del Prado. Imagine that your joints, knees, hips, hands, have a natural cushion called cartilage. This tissue allows bones to glide smoothly without rubbing against each other. Glucosamine sulfate is a substance that our body naturally produces, acts like a building block to build and repair cartilage, is found in the fluid that lubricates the joints, helps cartilage retain water and maintain its elasticity. Where does it come from? Most glucosamine sulfate sold as a supplement comes from crustacean shells, crabs, shrimp, lobsters, although there is also a plant-based version obtained through fermentation. What does science say? Updated research. Scientific evidence on glucosamine is like a puzzle. Some pieces fit and others don't. Here's a clear explanation. What is supported by evidence? Glucosamine sulfate, not other forms, may reduce knee pain in people with mild to moderate osteoarthritis when taken for at least 6 months. High-quality studies show improvement in joint function and pain reduction compared to placebo. Some long-term studies, 3 years, suggest it may help slow cartilage degeneration. What is not so clear? Not all glucosamine products are the same. Pharmaceutical-grade crystalline glucosamine sulfate has the strongest positive evidence. Glucosamine hydrochloride, another chemical form, has not shown the same benefits. Results vary from person to person. Some notice improvement, others do not. Summary of the evidence: type of benefit, level of evidence, knee pain relief, moderate, better with long-term use. Improved mobility, moderate, long-term cartilage protection, limited, only with specific formulations, osteoarthritis of the hands, hips, spine, limited evidence, additional benefits beyond the joints, although its main use is for joint health. Some research explores other possible benefits. For the joints, reduces local inflammation in the joint, may decrease the need for anti-inflammatory drugs, NSAIDs. Cumulative effect. Benefits are usually noticed after 4 to 8 weeks of consistent use. Possible additional positive effects. Gut health. N-acetylglucosamine may help protect the intestinal lining, skin, participates in the production of hyaluronic acid, important for skin hydration metabolism. Some observational studies suggest people taking glucosamine may have lower cardiovascular risk, although more research is needed. Combinations that may enhance its effects. With omega-3 fatty acids, this combination has shown effectiveness for long-term joint pain with chondroitin. Although evidence is mixed, many people use both together as a cartilage repair team. With MSM, methylsylvanylmethane, may enhance the anti-inflammatory effect. Contraindications: WHO should be careful. Glucosamine sulfate is generally safe, but there are situations where caution is recommended. Not recommended in situation. Reason: confirmed shellfish allergy. Although purification removes allergenic proteins, there is a theoretical risk of cross-reaction. Pregnancy and breastfeeding: there are not enough studies proving safety during these stages. Children and adolescents: its use has not been studied in people under 18 years old. Use with caution and consult a doctor. Situation, recommendation: diabetes. Current evidence indicates it does not negatively affect blood sugar, but regular monitoring is recommended. Use of anticoagulants, warfarin, may increase bleeding risk. INR monitoring is required if combined. Asthma: some cases report worsening symptoms. Use under medical supervision. Glaucoma: there is theoretical concern about increased eye pressure. Consult an ophthalmologist. Liver disease: although rare, isolated cases of liver issues have been reported. Caution is advised in vulnerable livers. Common side effects, usually mild. Stomach discomfort, heartburn, nausea, diarrhea or constipation, headache or drowsiness in some people. Taking it with meals reduces digestive discomfort. Indications for use: WHO may benefit. People most likely to benefit: adults with mild to moderate knee osteoarthritis seeking pain relief, people who prefer natural alternatives to traditional anti-inflammatory drugs, those who engage in intense physical activity and want to protect their joints preventively, people over 40 to 50 years old with early joint wear, people who will probably not notice benefits, very advanced osteoarthritis with severe structural damage, joint pain caused by non-degenerative conditions, infections, fractures, active autoimmune diseases. Those expecting immediate results. Glucosamine works slowly. Practical advice: glucosamine is not a magic wand. It works best as part of a comprehensive approach: proper movement, healthy weight, anti-inflammatory nutrition, and consistency in treatment. Dosage: how, how much, and when to take it, recommended dose, evidence-based, ways to take it, option, how to take it, advantage: single dose, 1,500 milligrams once daily, more convenient, better adherence: divided dose, 500 milligrams, 3 times daily. Some studies suggest better absorption, best time to take it, with meals, improves absorption and reduces stomach discomfort. Consistent schedule: taking it at the same time every day helps create habits. Treatment duration: what product should you choose? Very important, not all supplements are equal. Look for glucosamine sulfate, not hydrochloride, * pharmaceutical grade crystalline formulation, the one used in clinical studies, purity certificate and third-party testing, clear origin, marine or plant-based, depending on your needs. Recommended combinations, FINAL summary, frequently asked questions. How long does it take to work? Generally between 4 and 8 weeks. Benefits become more noticeable with continued use. Can I take it if I don't have osteoarthritis? Yes, especially if you do intense sports or seek prevention, although it is not essential if there are no symptoms. Does it cause weight gain or contain calories? No. It does not provide significant calories or alter fat metabolism. Can it be combined with other supplements? Yes. It works well with omega-3, turmeric, collagen, or hyaluronic acid. Avoid mixing too many supplements at once without guidance. What happens if I stop taking it? Benefits may gradually decrease. Some studies suggest a residual effect for several weeks after discontinuation. Important reminder: this guide is informative. Before starting any supplement, consult your doctor or healthcare professional, especially if you have chronic illnesses, take medication, or are pregnant or breastfeeding. Integrative approach: glucosamine is just one tool. True joint health is built through conscious movement, balanced nutrition, stress management, and quality rest. There is an upcoming video about plant-based glucosamine for people allergic to shellfish or for vegetarians. Don't miss it, it's very interesting.